From the South Carolina Honors College, this is Polluting Patients. If the U.S. healthcare sector were a country, it would rank 13th in the world for greenhouse gas emissions. The goal of Polluting Patients is to teach people about the environmental and corresponding health impacts of the U.S. healthcare system and what we, as healthcare consumers, clinicians, and leaders, can do about it.
Welcome back to Polluting Patients. I'm your host, Miley Phillips. On our journey together on Polluting Patients, we have learned the problems the healthcare system is causing for the environment, as well as our health and the ways the system can be more sustainable. But now, what can we do with this information so that change actually happens and we start moving towards a greener future for healthcare that benefits us all? Well, that is what we'll be talking about today. Ways that policymakers, healthcare leaders, healthcare providers, and consumers can push the system to start making positive changes. So I wanted to go ahead and start with the big stuff, the macro interventions that have the potential to make the most change, which is policy changes. Now, this isn't to say that personal action and individual clinic and hospital system interventions are not important and impactful. They definitely are. However, policy changes and individual actions are actually pretty intertwined. So this is why I wanted to start here. And if you don't believe me, I wanted to show you that proof is in the pudding with the impacts that policy changes can have by looking at a government and healthcare system that integrated pledges and actions for sustainability into their governing policy. Can you guess what country and what system? Now, if you guess the United Kingdom and the NHS, then you would be right. In 2020, NHS became the first health system in the world to commit to becoming net zero for direct emissions by 2040 and net zero for indirect emissions by 2045. Now, in 2020, experts created the Delivering a Net Zero NHS strategy in order to decarbonize the NHS. And this includes actions and policies such as transitioning to renewable energy, reducing waste, and promoting telemedicine, as well as implementing greener supply chain. To further the impact of this strategic plan, in 2022, the United Kingdom's government passed the Health and Care Act, which mandated that all NHS trusts, which are the regional organizational units that manage local healthcare delivery, as well as integrated care boards, who are responsible for the planning and funding of health services, adopt green plans. And while simply just the action of these mandates are great, they've also been shown to work. In the fiscal year for 2024 to 2025, the emissions from the NHS were estimated to be 4.7 metric ton carbon dioxide equivalent. Now, this was reduced by 14% from the fiscal year 2019 to 2020, which is the year that the policies and mandates that I just mentioned that committed the NHS to becoming net zero were implemented. To kind of put this reduction of emissions in perspective, this 14% reduction in emissions is equivalent to about 1 million people flying from New York to London. And while the policies and mandates that the NHS and UK have implemented so far and are continuing to do on their journey to becoming carbon neutral are a great example of the power of policy change. What's been done in the UK cannot directly be copied here in the United States. This is because, and as many of you already know, the NHS is a health system where the government is the single payer for all healthcare services. In the UK, there is also a private sector for healthcare, more similar to what we see here in the US, but the majority of the healthcare sector in the UK is funded by the government. So this means that in the United Kingdom, the government has way more say in the operations of the healthcare system than here in the US because the healthcare system is part of the government. So how do we take the example of the UK and NHS and make these policies work here in the United States? First things first, The United States needs a permanent agency that oversees climate action in healthcare at the national level. Such an office already exists within the Department of Health and Human Services with the Office of Climate Change and Health Equity. Therefore, policy that gives this office national governance to coordinate climate action in healthcare, as well as the necessary funding and staffing to do so, should be created and enacted. Once there is a national agency that is established that is able to oversee public and private coordination for sustainability in healthcare, a national database that gathers greenhouse gas and other sustainability related data needs to be created, as there currently is none. This will allow for any targets and goals for emissions that are created to be actively monitored. Additionally, here, influence and partnership with the EPA is crucial to allow benchmarking and performance tracking using a standardized set of metrics that is already in place for other industries in the United States. Once we have a national office and a national database, policymakers in the United States need to create a national emissions goal and implement mandatory emissions reporting. This isn't that crazy of a reach for the government into the private sector because such goals and reporting standards already exist for several other industries in the United States. But how can the greenhouse gas emission reporting mandates be implemented for both the private and public sectors within healthcare? Well, you have to target the money. The strengthened Office of Climate Change and Health Equity should work in conjunction with the Centers for Medicare and Medicaid to mandate emissions reporting as a condition of participation for Medicare and Medicaid reimbursement. Now, there are already hundreds of conditions of participation for reimbursement for hospitals to provide services paid for by Medicare and Medicaid, and codifying mandatory emissions reporting as well as tracking of sustainability indicators in the conditions for reimbursement will have a huge impact. Additionally, creating requirements for hospitals to prioritize the procurement of items with minimal packaging as well as reusable medical devices could also have a huge impact. Now, how can this impact both the private and public sector? Well, on average, 30 to 40% of United States hospital revenue comes from reimbursement from Medicare and Medicaid. So by putting these mandates within the conditions for reimbursement from the Center of Medicare and Medicaid, majority of hospitals will have to comply as they get a large part of their payments from Medicare and Medicaid reimbursement. This is also just helpful in general because policies like this help to establish a uniform regulatory framework that in turn accelerates national action and helps to mitigate the logistical complexity and cost of implementing mandates and policies across private and public sectors. There are also some existing policies in the United States that could be expanded or used as a guide to further commitments for sustainability. Specifically, the Inflation Reduction Act of 2019 offered funding and tax incentives for the implementation of renewable energy such as solar, wind, and waste energy into existing and future structures. This bill included both for-profit and nonprofit hospitals and hospital systems, giving the healthcare sector a chance to save tons of money while making positive changes. This policy can be used as a blueprint and guide for other policies that would further mitigate the sector's impact. For example, offering grants or tax credits for facilities that install on-site wastewater systems that minimize transportation and associated emissions and promote water conservation. I could keep going on and on about different policy level interventions that I think would have the capacity to make significant amounts of positive change, but I think you all get the idea. In general, policies that encourage reusables, accountability at the supply chain level, the implementation of sustainable energies, and emission reductions, goals, and transparency of reporting is what is most important and should be focused on. So, with that, I want to kind of move down the pyramid and look at interventions at the hospital system or clinic level. Without being forced by national policy, there are a lot of opportunities for individual hospitals or greater hospital systems to reduce their impact and promote cultures of sustainability. The first step in doing so is joining green healthcare initiatives, where system leaders have the access to resources and experts on next steps in reducing their impacts. Hospitals can also take advantage of current policy and enjoy some tax credits by adding solar panels or save some money by switching to reusable medical devices and making their operating rooms greener. Managers within a hospital system can also educate and train employees on individual level actions for sustainability and the importance of proper waste segregation, as well as the smart use of medical supplies and PPE. Speaking of individual level actions, that is what I want to look at next. Individuals who work in healthcare can try and reduce the amount of supplies they use and therefore the amount of waste they generate. They can also commit to proper waste segregation practices and try and throw away recyclable or reusable devices in the proper receptacles so that they can later be reused. But there are also a lot of things that can be done by people outside of when they're working in a clinic or hospital. And one of the biggest ways to make an impact on this problem is for us to use our voices. Using our voices to push current legislators to make policy changes like those that I outlined earlier, as well as spreading the word and educating others on the environmental and health issues that are resulting from the healthcare sector so that more people know about it and then want to do something about it. Additionally, going out and voting for people in local, state, and federal elections that promote sustainability and positive climate action on their policy platforms when they're running is another great way we can use our individual power to make an impact on this problem. Overall, making the problem known, pushing the people in power to make changes, and just using our power to make change are some of the most important things as individuals that we can do to begin positive actions that mitigate this problem. Now, what I've shared with you all today is not an exhaustive list of all the different ways that we as healthcare consumers, clinicians, and leaders can take action to promote climate smart healthcare. But I just wanted to show some evidence and hope that there are things that can be done to help this problem and energize us to start taking action to do so. Going off of that, next time, we will feature an interview with a current leader in the fight for climate smart healthcare, student Dr. Akil Mandalapu. So with that,
Thanks for listening to Polluting Patients. Remember, a healthier planet is a prescription for healthier people. Keep pushing for sustainability in healthcare. See you next time.